I just got a patient contacting us interested in a hysterectomy. She was quoted $58,000 for that hysterectomy. At Renovo, it's going to be from $8,000 to $11,000 all in. And I don't know, I mean, that just seems kind of silly, doesn't it? How much savings that is. But those are real numbers that patients really experience.
And we can work with you tomorrow. This is not something you have to wait for another year before you can utilize.
Yeah, and we like to encourage decision makers in companies to really think of this as a strategic advantage, not as of I'm managing this necessary evil of healthcare cost. It is that, but we want you to think bigger than that. That is, this is part of a strategic advantage where I'm now achieving savings so that I can invest in the things that are important to taking care of my customers, to providing better benefits for employees, providing better spaces for my employees to work in, capital investment, opening new sites.
All right, so we're here with Dr. Josh Johnston with Renovo Health. My name is Chris Moore, and I'm with Savvos Health. And today we're going to be discussing how to set up a direct payment between you, a local business owner, and Renovo Health Surgery Center and Infusion Center right here in town, right here local. And the main reason for that is you can save a significant amount of money in your health plan, and actually you don't have to wait, so you can turn it on now. Like, this is a real easy direct pay option you can utilize right away. So there's tons of cost savings locally for you. We are going direct with Renovo Health. And we're going to talk about this will be combating the rising premiums, the high deductibles, the lack of transparency, and how to get your employees out of the black hole of billing. Well, you can waive employees out of pockets and deductibles by going direct with Renovo. And we're going to dive into all this in detail. In addition, your employees are going to get the best possible experience in healthcare by going direct with Renovo locally as well. And we're going to dive into how this works. But first, I'm going to turn the time over here to Dr. Johnston. He'll explain the benefits of going directly to his facility, what you get out of his facility specifically, and also how dramatically his costs can beat the local network rates that you're dealing with through your health plan. And then afterwards, I'll jump into how we make this possible and some common cash pay problems we solve for employers. And that's the benefit of having a tech platform to support all of this. So yeah, now let's hear it from Dr. Johnston over there at Renovo Health.
Thank you for the introduction, Chris, and thank you for your partnership in bringing this clinical opportunity to payers and businesses in the area. So to all those that might be listening or that might pull this up and listen later, welcome, and feel free at any time to interject via the chat with questions or to reach out to either one of us afterwards directly. Renovo Health is a direct pay surgery, endoscopy, and infusion center. We are the product of a couple of physicians frustrated with the way their patients get taken care of in the typical system, and frustrated with feeling like we are witnesses to a crime, particularly that is of bankrupting America and not giving particularly patient-focused care. And as caregivers, it's very frustrating to feel like the patient isn't your top priority because of all the other demands in the other systems. So Renovo is formed as a way to provide value to patients and payers, which ultimately for most people is their employer. We want to make healthcare enjoyable for patients, for caregivers, and we want to make it not bankrupting for employers. And that's the motivation behind everything we do. That's our bottom line. And if you're interested in that, then we're interested in working with you to make that happen. We are not inflexible and automated like the traditional health systems. We are dynamic and innovative and ready to work with you to solve problems. So, and I know Chris is on the same page with that and can help especially a lot on the plan side with integration and compliance. So patients come to Renovo, they get a patient-centered experience because they are the customer. And we don't have 5 other masters telling us what boxes to check as a first priority before looking at the patient. And we have all board certified physicians that are working with us. And currently we offer care in the areas of interventional pain management, gastroenterology, endoscopy services like EGDs, colonoscopies, urologic services, general surgery, and gynecologic surgery. Also do some pediatric dental work if anesthetics are required. All of those areas growing. So we expect our service offerings to grow organically as those we serve have more needs and as we develop relationships with physicians in the area. So that is not a fixed slate, but those are the areas right now where we're offering patients excellent care at fair prices. Completely unlike any of the traditional systems, all of the prices are bundled. They are set up front. They are published. You can look at them on our website. They include all services necessary for those procedures. So if you are talking about a common service like a colonoscopy, that includes the pathologist, that includes anesthesia fees, that includes all the facility fees. It includes if you have polyps. It includes, so this is what when we say a bundled price, we mean that it includes everything to walk in the door and walk out the door and anything related to that. No 6 months later surprise bill from a different part of the team. So I think those tell you most about kind of who we are, kind of the flavor of our philosophy. Just emphasize again that we really were made to provide solutions for employers. And so if employers are interested in making a solution work, we can make that happen. We can find a way to make it the right solution for you. So the hard part, that easy part is taking care of people, right? The hard part is doing all the technical compliance and putting it together with the current health plans. But Chris is good at making that easy for everyone. So you want to talk a little bit about some of the ways that Renovo can be either brought into a plan or added onto a plan?
Absolutely. Absolutely. Yeah. The easy part, you're taking care of just, was that 12 years of medical school and then getting your residency and your fellowships and, saving people's lives. The easy part, Renovo did that. So we're the hard part coming here at the end, the add-on. We're the difficult side. So yeah, like Dr. Johnson, you hit the nail right on the head. The Savvos, our whole mission is trying to fix healthcare. And what we're focusing on, where we see the biggest problem is just the transaction. Like how we pay for healthcare is what's really broken the system and has created misalignment between all the stakeholders. We mean everyone involved in a patient's care. So if your employee has to get care, they need a colonoscopy, they need a rotator cuff surgery, whatever the case is, everyone involved in that, you, the employer who's going to pay for it, the employee themselves are going to get the care, the doctors, the anesthesiologist, the physical therapy if it's an orthopedic procedure afterwards, everyone involved there, no one's talking to each other. Because right now you have your facility and you have the surgery center, and it should just be a real easy, you pay them for their services. But instead, how the current model works, the broken system, you file a claim. And this claim gets sent out to the network and it enters this black hole where the insurance companies try to figure out how much they should pay the doctor and how much balance bills they should send to the patient. This black hole of claims adjudication. Everybody knows what we're talking about here. You get balance bills, you have no idea what it's going to be cost. You thought you paid your deductible, but you get a bill anyway. You thought you paid everything, but then you get a second portion of the bill for the anesthesia or for the hardware. And that's what Dr. Johnson says when he mentions like the total bundle. Everything involving your care is involved in their upfront pricing. So that's what we're trying to fix here at Savvos. We're trying to fix that transaction and just allow you, the employer, to pay the provider, the surgery center, the doctors directly, and just bypass that entire claims adjudication black hole, that just nightmare that you kind of get after you have your physical surgery. So Savvos, we're a tech platform, and we're essentially, we have a couple different options, but here in Wisconsin, we're a bolt onto your existing plan. So even if you've just finished your open enrollment, you've just kind of finalized your health plan for next year, we can still work with you, and we can work with you tomorrow. This is not something you have to wait for another year before you can utilize. You have a sore shoulder coming up, we can work with you. We can get your patient scheduled with Renovo, whatever he needs a colonoscopy because he's turned 45, one of your employees, okay, we can get him scheduled in January with Renovo, and you can start seeing cost savings on your plan immediately. So, and this is significant because when we're working with employers and we're working with employees, the healthcare is expensive. We're trying to save costs on your healthcare at every scheduled outpatient surgery. So if we know going into it what the price is going to be, and it's going to be significantly less than like the network rates you use already, then you start adding those up throughout the year. You're going to save your plan a tremendous amount of money. You're going to be able to pass that cost savings on to your employee. So at Savos, what we're able to do, because we know the significant cost savings we're getting with Renovo by sending your patients over to see Dr. Johnston and his other fellowship trained surgeons there, you're going to be able to offer a tier one $0 benefit to your employee. And that means because, like, for example, if they went to a regular network hospital and I'm just going to pay for just have a colonoscopy, your rates there might be around, the employer is going to get billed maybe $6,000, $7,000. Depends on your market, your network rates that you have with your health plan. But if you go direct to Renovo, the total cost of everything, including pathology, including anesthesia, is going to be around $2,000. Is that right, Dr. Johnson? Right, that price there?
For a colonoscopy?
Yes, sir.
Yeah. So for a colonoscopy, it's 2,900, but
yeah, 2,900, right in that range there. So 2,900. So let's just say the network rate's $6,000 that you'd pay otherwise through insurance, and getting the bill later in the year. You're not quite sure what that rate might be. It might go up, might go down, but you're going to save just on a single patient $3,000 there. And then let's say you have 10 patients in the Q1, 10 employees that need to get the colonoscopy. You're looking at $30,000 in savings just in colonoscopies. And then the bigger the procedure, the bigger the cost savings we see. So you get a hysterectomy for an OBGYN procedure. Like in some hospitals, that's as high as $45,000. And I think at Renovo, again, is that just the hospital fee, just the facility fee? Is that include the physician fee, the assistant physician? Does that include anesthesia? You don't quite know up front unless you're really comfortable calling a hospital billing department and breaking down a bill and know exactly what to ask for. You're going to get those surprise bills. You're not quite sure what's included in that price. But at Renovo, I believe it's around $8,000 for a total bundle for their hysterectomy. Is that right, Dr. Johnston?
yeah, that's true. Yeah. So as I was talking about Renovo's genesis and the philosophy of care, the way that we are able to achieve those missions of reducing the cost of care and reconnecting patients and caregivers is really by that process that Chris just mentioned. So that of cutting out the middle process, that black hole that he talked about, which is typically in a typical medical practice is taking up about 30% of all the medical practice's cost, is maintaining that black hole. It's the cost of doing business, maintaining that black hole. If you are able to interact directly with employers and patients, you immediately take off a third of your cost, right?
So that's a third of your cost, chasing your own money, what you should be paid. Is that right?
Yeah. Yeah. So just by directly interacting with consumers, you can take off a third of the cost on average. Sometimes that's more, sometimes that's less, but that's a third of the cost on average. And then Renovo has the advantages of not having the advanced administrative state that is the state of most health systems. So, and it's not necessarily their fault because there's a lot of compliance issues and there's a lot of competing interests that they deal with. But, we don't have an army of administrators. We have caregivers and people that help connect you with those caregivers. And that's by doing that, you save another 20%. And then finally, by just charging people what things actually cost for equipment and things like that, you typically save another 10 or 20%. So we, the medical system, the dirty, dark side of the medical system is all of the markups that occur through the various middlemen in the process. I guess it's not dirty, it's a normal part of business elsewhere, but it's just, you don't see it, you don't know it, right? So a medical piece of string becomes $150 instead of what you can get at Walmart, which is $3. But that whole process, we don't participate in that. So you add all those things together: elimination of the bureaucracy of insurance, compliance, billing, collections, etc., the efficiency of our process because of our ability to be patient focused, and the not padding the pockets of every middleman on the way to bringing a product to you. That's how typically on a surgery we save 50% or more of the legacy costs. So I just got a patient contacting us from the Upper Peninsula, interested in a hysterectomy. She was quoted $58,000 for that hysterectomy. At Renovo, it does depend which technique we do, but it's going to be from $8,000 to $11,000 all in. And I don't know. I mean, that just seems kind of silly, doesn't it? How much savings that is. But those are real numbers that patients really experience. So that's a little interjection. Sorry to interrupt you, Yuranjing, but that's kind of how Renovo is able to save costs to patients and their employers.
Yeah, as you know, it's incredible. It's not if you've been in this side of the business with self-funded employers and direct to the provider, direct to employee, you see that cost saving every day. Like in other Savvos Health in other states, like the bigger the procedure, you start getting a lumbar fusion, you start getting the cervical disc replacements. The cost savings are now $100,000, $75,000. But even small ones, right there, that hysterectomy is you just save $40,000 on a single procedure. So if you do 3 of those next year in 2026, you've just saved the employer $120,000. It adds up rapidly. So then you get 20 patients throughout next year that we redirect to Renovo Health. You're looking at $500,000 in savings. It's staggering. And for a small business, that's significant. Those numbers are so incredibly significant, that cost savings. And then because it's such a dramatic cost savings, then the employer can say, okay, I'm going to pay for all this myself. The company, we're going to pay for you. We're going to waive your deductible. We're going to pay it all. So you can just go get your care, because by going direct to the provider, we've now saved so much money. I can offer this $0 benefit. That's what we call it in the self-funded bit. You're offering a $0 benefit, a tier 1 $0 option. So, and I just imagine for your employee base, if you can start offering healthcare incentives like that, like, hey, you can go to the hospital, you can pay your $8,000 deductible, your $5,000 deductible, and then we can pay the rest of the $45,000 bill that's coming. Or if you go over here to Renovo Health, you can go as the patient, the employee, you can go for free. We'll waive your deductible and the employer will pay for you in full, because the cost savings are so significant. So just imagine the loyalty of your employees now as they start getting these $0 benefits, how excited they are to be working, because now they have healthcare that really feels like a healthcare benefit, as opposed to, they're in January. A lot of you have probably already had your renewal conversations. Most people's premiums have gone up. Some of the people we've talked to, some of these companies, their premiums have gone up as high as 30%. And different states have gone up even higher. So they're going to be paying 30% more every month. They have to spend thousands of dollars throughout the year of their deductibles before they can even start getting an insurance benefit. And there's always a fight with that. Once they do, there's always a balance bill they try and sneak in there. Or you can say, okay, right away, all right, let's just take care of you. Let's just waive this deductible. You're still going to pay your monthly premium, but let's just waive this deductible for this procedure. We'll take care of you. The experience with the employees is so much better. There's not this anxiety or people withholding care, worried about going to see a doctor because they're concerned about how much it'll cost, because now we've just made it fair cost. So this is kind of the underlying beauty of this system. So at Savvos Health, working with providers like Renovo Health and Dr. Johnston and his team over there, our whole motto of fixing healthcare, our CEO likes to say all the time, you can't build the future of healthcare on yesterday's model. It's a broken system. So we're going to approach things differently. That's why we're bringing up this direct to provider, direct to employer. You guys can connect right with the local healthcare solutions in town at Renovo Health, and you can save a ton of money. But that's where Savvos Health comes in. So we have the doctors. We have Dr. Johnson and his team. They have the care they're providing. That's what they do. They're there. They're ready to meet you. They're ready to connect with you. Kind of this boutique healthcare experience. And then Savvos Health, this is where we come in. We're the how. We're the ones who make this possible. How can you just turn this on? As we say, how can you turn this on tomorrow? So we are a technical platform that supports this direct pay care to the providers. And because we've talked to other employers in other states the past couple of years, and that we've seen very common stumbling blocks. And Dr. Johnson's talked about it, and I'm going to kind of dive into it. We kind of solve these 3 big problems to make this direct to employer, a direct to provider solution possible. So the first one he mentioned is compliance. You can't just, if you go pay a doctor in cash and he'll say, okay, he takes $8,000 for that procedure, thank you, but you don't handle the compliance reporting properly, it's just been an under the table cash payment. To have this count towards your spec and ag limits throughout the year, So I'm going to kind of break this down in a second. If you're listening to this, you're not quite sure what that is. But to have this count towards your health plan savings, you have to report it properly. You have to report it. So every employer who is self-funded and you have your health plan, there's a limit, because someone might have a really big emergency case, and to suddenly be expected in March, the end of Q1, to suddenly pony up $1 million for a severe emergency, and for life flight, things like that. Every health plan has called stop loss. It's reinsurance. So when you reach a certain limit, either per patient or for the kind of, we call it the aggregate, the entire plan. When you reach these limits, then the reinsurance, like an insurance for your health plan, kicks in, or the stop loss kicks in. And stop loss is kind of like the unseen hero in all these health plans, and they get very little love, because during the renewal that we're all going through right now, the open enrollment, everyone's shopping around different stop loss companies, and it's not really their fault, because the cost of healthcare is getting more expensive every year. So when the employer exceeds their limits, and if every year it's getting more expensive, they're doing it sooner and sooner, the reinsurance has to kick in. And if you're using more of the stop loss, the reinsurance, when it comes to renewal, that's why premiums are part of it. A part of the reason premiums go up so much every year, because now the reinsurance you've used this entire year, all the other stop loss carriers look at it, but, well, this is an expensive plan to underwrite. Your employees are utilizing your health plan so much, we have to increase the premiums to kind of cover our end. So it's kind of like a never-ending cycle of increasing cost. But for a health plan, the beauty of going direct to a provider, immediately, as Dr. Johnson said, this isn't hyperbole, you're dropping your healthcare costs by 50%, and you're pushing off that utilization of bringing in the stop loss till, we'll say Q3, Q4, or unless you have a specific patient with an emergency, until that happens. But throughout the entire year, if the employer is covering all these costs, then long term, at renewal next year and the following year, the stop loss pays that cost back to you. You get to stabilize your premiums, and in some cases, we've seen reduction of premiums at renewal. It's pretty amazing. So there's long term benefits to this reduction of costs, reduction of price, going directly to a provider. And that's kind of the compliance reporting. Now we get to the reporting side of that. If that's kind of a deep dive, I apologize, everybody, but you have to get the right data to the stop loss, so they count that towards your health plan, towards the health plan saving. And that's what Savvos, as a tech company, we automate that process. We're automatically, when we're scheduling a procedure with Renovo, first of all, it's an entire different transaction. We'll dive into this in a minute. But we're gathering all the data. We're gathering the physicians, all the tax ID numbers, the CPT codes, the prices for those codes. We're gathering all that in when it happened, and we're sending that automated reporting to the TPA, to the stop loss, so that they can compliantly count that towards your health plan, what the cost you spent that year. That's a massive step. If you were to figure that out yourself, it is an incredibly complicated step. So we just, as an automated process, we kind of bolt that onto your existing plan right now. That compliance reporting, very overlooked, but like an integral part to like long-term savings with your plan, and then being able to offer that $0 benefit to your employees. That's kind of a first. We kind of did a deep dive into stop loss and compliance there. And then that takes me to the next step right away, the incentive. How do you layer in incentives? Like, because right now, how it works, if your patient has an acre of pain and they go to a local urgent care and they get referred to a doctor, Dr. Johnson, like, what's the local urgent care's incentive to send you a patient? Is it, as opposed to sending it to the local hospital or medical center?
Yeah, so they have no incentive to send them to us, because they will get in trouble if they do that.
Yeah, they're going to get in trouble. And also they're like the in-network, is, we call it steerage in this. The urgent care is going to refer to whoever their network is, or whatever company owns them in the hospital. It's just the nature, nothing insidious there. It's just the nature of the business. So there's no, because a lot of employers are thinking like, well, why don't we just like if they have an acre pain, we'll just tell them to go there. But there's no, if they go and they present their ID card, there's no incentive. Like, no receptionist is going to say, okay, go see Dr. Johnston next week at Renovo. It'll never happen. So to really capitalize on this cost savings, you have to put incentives into your existing health plan. And Savvos has kind of like turnkey language you can turn on again tomorrow or next week, once we kind of review everything with you. You can turn it on next week, and we can add that turnkey language, so that if you go to the regular hospital, you can still utilize your existing health plan's deductible insurance. You can still use it, of course. But if you want to have a $0 benefit, we layer that. If you choose to go to Renovo Health for your care, then the employer, legal, will offer you a $0 benefit, will cover your cost of healthcare. And that's some turnkey health plan language we add on, and then you can just start utilize Renovo right away. And the other side of that too is kind of the engagement with the employee. Our platform with Savvos Health, and we work with these very fair cost, savvy providers and at Renovo Health and in other states as well. They're engaged right on this platform. So we're changing this idea. You go get your health care, and then, because if you ask, how much is it going to cost? No one has any idea. Well, I said, what's the cash? Let me check the cash discount rate. Like, it doesn't make any sense. But like Renovo, they've built out, these are our fair costs. This is, if we do the care, we take care of you, we do the surgery, this is how much it's going to cost us. This is a fair cost for us. So we have all of that in a single conversation on our Savvos platform. So if your employee needs care, we say, hey, listen, you can go utilize your regular insurance. Or if you come connect with Renovo, you can connect with their scheduler or online ahead of time. You can connect with the doctors online. You can ask them questions. Everything happens in a single place, and all the costs are broken out ahead of time. So we're discussing costs, we're finalizing costs. We're the representative for your health plan to finalize your costs. You're going to see what the total price is going to be going to Renovo Health ahead of time. And when you approve it, that cost is locked. So you're not going to get a balance bill. It's not going to change. So like, okay, so the hysterectomy is scheduled for January 15th. It's December now. Okay, like now we've locked in the cost. It's going to be because of XYZ. They have their consultation. Dr. Johnston looks, well, it's going to be the other procedure. They review the patient. Okay, it's going to be $8,500 final. That's pathology, that's anesthesia, that's everything. That's the final cost. And you, the employer, get to see that. You get to review it, you get to approve it, and you're locked in. That's it. The cost is done. So we've layered in those $0 benefits for you, and that incentive for your employee. If you go get your care at Renovo, you're going to get it for free as an employee. And there's a third step here, like how the final step of this kind of like is a sticking point for a lot of employers to try to do this themselves, is the actual transaction. How do you pay Dr. Johnston? How do you pay Renovo? Or like, how do they get the money from these employers? Because if they're doing it themselves, connecting to all these employers, they have to kind of figure out how to get their money from 10 different companies, 10 different ways. Is the one employer going to have like a copay for their employee, or are they going to make them pay some of it? So with Savvos, we take care of all that. For Renovo, we provide a digital cash payment rail. So we connect the employer with the provider. So we finalize the cost, we lock it. The week before surgery, we pull the funds from the employer. So the day of surgery, everything goes according to plan. The patient finishes and goes home. The team from Renovo can access the Savvos platform and pay themselves in full. So there's no waiting. How long, Dr. Johnston, on average, if you're going through like a network claims process, what was the timeline on getting paid?
6 months is you shouldn't count on anything before 6 months.
And if you're new to this conversation, I'm nodding along with it. That's insane. That's just pure insanity. Just like if you go to a mechanic and you tell them, I'll pay in 6 months, like they're just like, get out of my office. Like don't ever, you're gonna get sued. Like you have to. The idea that the doctors, the ones who went to medical school, the specialists who are saving your patients' lives, they have to wait 6 months to get paid. It's just pure insanity. So we solved that problem. This is another reason why Dr. Johnston is offering such dramatic cost savings, is that he's getting paid the day of. He doesn't have to account for, he mentioned this earlier, the next 6 months is not just him waiting. His billing staff has to aggressively chase the insurance company to get paid. When they'll get a denial. They have to dispute a denial, that claims adjudication. They say like, well, they want to negotiate after the fact. We're just paying him up front in full. And that's why, as an employer, you're going to get the best rates when you go to Renovo. So as a little recap there, we talked about compliance reporting with Savvos Health. We layered in the incentive, the $0 benefit for your employees, and also the digital cash payment rail, making that payment not in 20 days, not in 14 days, not in 6 months, immediately available for the provider. And that will, again, of course, result in significant cost savings. They give you that great deal.
Chris, I've got a question for you. Because it comes up frequently. So I am an employer and I'm a head of HR, and we're a high deductible plan with HSA. So now there's certain requirements upon us for who pays first dollar, and they feel a little bit paralyzed, like, well, there's no way I could possibly work with and offer a $0 incentive. Speak to that question.
Absolutely. So we do work with the high deductible HSA plans. It's slightly different. Because it's a high deductible HSA, there's a nationwide minimum deductible requirement. But a lot of these plans are not operating around the minimum deductible requirement. They're higher. They're a lot more at the 3,000, 4,000 deductibles with these patients. So what we do, and again, just a bolt on, we drop your minimum, or we drop your deductible down to the nationwide minimum, which is, I think, going into next year, it's going to be $1,700. It might be $1,650. I can't remember. We'll have to double check that. But we drop it down to $1,700. The standard nationwide. If you have high deductible HSA plan, we drop it down to the nationwide minimum requirement, which is, I think, 2026, $1,700. So yeah, but short answer, yes, we can work with high deductible HSAs. There's still going to be a member deductible, but we drop it down to the nationwide limit, which is $1,700.
And the cost savings, it doesn't change the cost savings for that employer. They're still seeing the same cost savings, as you say. So you have to deal with a deductible still, but that still is a easy sell to a member, an employee, that, hey, it's still money in your pocket, right? I'm dropping your deductible by X. So if you choose this, that's real money in the employee's pocket, which is important, right? To make this a fair thing, right? We want all people to succeed and to benefit from this process. So, if employers are benefiting, it makes sense that employees benefit in the transaction too.
Absolutely. Absolutely. We had this question come in here in our chat. What does it mean for the future of this business? So if you're an employer and we're looking at, so we talk a lot about utilization rates at Savvos Health. It's just where you're in the self-funded space. Because hopefully next year, every single one, if you have 100 employees, every single one of them aren't going to use or need a outpatient surgery. Hopefully not. That'd be kind of a terrible year. But we see kind of an average, especially like in the orthopedic space or the real common kind of elective procedures like hernia repair, smaller like ACL repair, shoulder surgeries, especially in companies where there's active employees. We're seeing around 10% utilization, sometimes as high as 20%. So that means if you have 100 employees, 10 to 20 of them are going to need a surgery next year. And if you just look at some of these cost savings that Renovo is talking about for a hernia repair, a really fair cost hernia repair, it depends on the type of hernia, of course, should be between $3,000 and $6,000. Just a real fair cost. And that changes, of course, state to state. But some of these hospital network rates, and nothing against the hospital, they're doing their job, but they're part of this network rate that includes the entire insurance billing company and all their intermediaries. We've seen them as high as 20 to 30,000 for a hernia repair, and it should be, let's just say, 5. So we've just saved you $25,000 on that hernia. So for this employer, if you get 10 of those in a year, you're looking at $250,000 in savings just on 10 hernias. For the bottom line of a company, especially if you're a small company or you got a lot of stiff competition, if suddenly you can drop your savings down, it's like you're reducing your spend by $250,000. Like you could give a raise to someone who's high performing. You don't want it scooped up by your competitor. Or if you're a smaller business, and you're growing rapidly, okay, that's extra funds to bring on like a real A player. Like I know this guy over here in this other company or this other field, we'd love to bring him in here, but we just can't afford it right now. So if we can just save, all this saving it's night and day for these employers. If we can save that much money, we can just pay all of our employees. Man, they haven't had a raise in 2 years because we've just been barely scratching by. And part of that reason is our healthcare costs are so high. So you reduce it, just those 10 hernias, $250,000 by the end of the year. Well, you can give a lot of raises to people, get them really happy. And a lot of these employees, that have been there 10 years at the top of your team leaders, and they're looking at some other jobs because they do a career shift. They might get a bump up. Man, you want to keep them happy, keep them there, pass that savings on. So it's really, for smaller, mid-sized businesses, this cost saving is tremendous. So, and they can just take advantage of it right away.
Yeah. And we like to encourage decision makers in companies to really think of this as a strategic advantage, not as of I'm managing this necessary evil of healthcare cost. It is that, but we want you to think bigger than that. That is, this is part of a strategic advantage where I'm now achieving savings so that I can invest in the things that are important to taking care of my customers, to providing better benefits for employees, the things you were just talking about. So providing better spaces for my employees to work in, capital investment, opening new sites. I mean, I like to talk about school districts, right? School districts are very common self-funded entities. And you think about, you're talking about $120,000 savings. I mean, just think about what that is in a school district. Sure, they've got huge budgets, but if you look at an individual classroom, that's quite a difference. That means extra classes, extra teacher, extra support to teacher, extra facilities. And you just multiply these things, of course, to scale. If you're no longer talking about 120 people, but you're talking about 15,000 people, you just multiply to scale. And the opportunities are really strategic for leaders of these districts, of these businesses, et cetera. So we really encourage people to think about it as a strategic advantage and not as a kind of bookkeeping.
Yeah, absolutely. And then also strategically, you get to, if you're the leaders of this company right there in town, you can come in and you can meet Dr. Johnson and his business partner, Dr. Breen. You guys can sit down together, like, well, this is what what my employee base really needs. We haven't even dove into the infusion side of this, which Renovo Health also provides. A lot of patients need regular infusion, sometimes just once a month or once a quarter. There's some drugs out there that are for like the cost of the drug, let's say, might be $20,000 a dose. Some of them are pretty high-end drugs that people need to survive or make their life they can go to work. And the bloat, we could refer to them at Savvos, they add, if you get that same drug, and let's say it's $20,000 of Renovo for Q1, but if they go to the hospital, that might be $80,000. We've seen this again and again and again, or $50,000 versus $10,000 for this medication, because they're not adding on all this extra costs that they have because of their giant kind of billing systems and the network getting involved as well. So a lot of these drugs, these infusion medications that the employees need, just that 4 times a year, you could save the company on one patient $100,000. And we've seen this again and again and again in other states. The infusion drug solution that Renovo brings as well, that's staggering cost savings that could really, really benefit a local business and, the local school districts as well.
Thanks for bringing that up, Chris. Yeah, I neglected to mention infusion care. So thanks for reminding people about that. Another aspect that we've talked about a little bit, but just a different perspective, is that a lot of people, you can read surveys very easily, that a lot of people avoid medical care because of costs, right? And especially people in high deductible plans, they avoid medical care because of costs. And then maybe if something happens where they have to spend that money and they meet the deductible, then they'll go pursue these care needs. But when you, as an employer, provide an opportunity where costs can be reduced or even waived for your employee to access healthcare, nobody wants to get surgery for fun, right? But you allow people to maximize wellness without feeling like they're going to bankrupt themselves or their families. And so you bring access to care to your employees so that they are not putting off something that is going to result in more trouble later, right? So they can fix something now that has a scheduled 4-month recovery period where they might be on limited duty versus not fixing that, going on, and then being hospitalized and having a bigger surgery, and then they're out for 3 months. So bringing down the costs doesn't just help finances, it actually can help productivity. And we have examples of that where we get to see patients that otherwise would not have sought care and take care of them. We had a patient coming down from Door County, it was a few months ago now, but the guy had a colonoscopy, had polyps, which is why we do colonoscopies, and he had a lot of them, and he needed follow-up. He wasn't going to get follow-up care. You know why? Because they charged him $16,000 because of all the polyps he had. They charged him $16,000 for his colonoscopy. And in his situation, he had to pay the lion's share of that. And he wasn't going to fall into that trap twice. He wasn't going to
$16,000?
Yeah. So he was not going to get another colonoscopy. Well, he said, oh, well, I'll just hope none of my future polyps turn into colon cancer. And what can I do? But I'm not going to go bankrupt to get this colonoscopy again. Heard about Renovo, and it's like, wow, where have you been? This is amazing. I'll come down and get a colonoscopy every year from you guys. Not quite, but so that is an example of where you take someone who is not going to get care that is appropriate, that would be recommended to anyone, and not going to do it because of cost. And then Renovo makes it something that they can feasibly do and still feed their dog.
Yeah. So before the example at the start of this webinar, all in, including polyps, colonoscopy cost was $2,900. And a lot of network rates are around 6,000. So that's a 50% saving. But with additional polyps that they took care of, 16,000 on a colonoscopy. That's like a high end price for like an ACL meniscus repair. So yeah, we've seen this other states too. We've had patients put off this all for, especially for musculoskeletal, for their shoulders and knees. They got an achy shoulder for years and it turns into a total shoulder. But 2 years ago, they could have had just some rehab and some different exercise techniques. And they kind of put their arm in a sling for 6 weeks. That would have been all right because they've strained their shoulder just doing their manual labor every day. It's not Renovo Health, but we have another surgery center we work with in Phoenix. And where I was joking with the head administrator there, like, are you going to send us any cases that are actually result in revenue? We're joking about it because we'd sent them like 13 referrals from our local partner, and all of them they turned into physical therapy recommendations. It's like, okay, this is the first time you strained your low back, do this. You twisted your knee. Okay, let's try rehab for 6 weeks. None of them resulted in surgery, but just that immediate care access, cost saving is another side of this as well. When they know that, okay, if something has to happen, it'll be affordable, but the surgeon might be like, okay, you just need rehab because like they're not, they're just pushing to take care of your employees. So we've seen this in multiple states already. But with the Savvos platform, and any employers listening to this, like we can hop on, I'll walk you through the whole process, kind of what this looks like. Your patient needs care. Like we can even set up with an employer like a text. You got an ache or pain because of this issue. Like, don't hold out. Just text Savvos schedule, and one of our care coordinators will hop on there, connect you with Renovo, see what you need, help you upload all your medical history, and you get to engage with the scheduler and with the surgeon right in our platform as the employee. And then Renovo will kind of put in their initial code, what they think it is. After the consultation, they finalize their codes and costs, and the entire time the members in there, and let's say we have to loop in imaging. Let's get you some imaging. Everything happens in a single conversation. And then the employer, gets in there, they finalize it, they pay for it. There's no surprise for the employees. Our team is kind of walking them through. Well, imaging's across town. Here's the address. Go there. Get the CD, come back, drop it off at Renovo. Okay, great. This is how it works. Like we've heard this 100 times at Savvos. Like I have never had an experience like that. That was the best experience in healthcare I've had in my entire life. It was all laid out in front of me. There was no stress about a balance bill. Everything was crystal clear. And then eventually with partners we've had for a long time, Savvos, we drift into the background. We just become this existing platform for the patients to connect directly with the healthcare provider. So then it's like, as opposed to saying utilizing Savvos, they start saying, well, hey, go to Renovo because I get this incredible cost savings there. Go use Renovo. They're incredibly clear. So that's the connection we're trying to build here between the employees and the actual doctors, not like a tech platform like Savvos. We're just trying to make it seamless so that both parties can talk to each other. And I'll send the finishing closing remarks over to Dr. Johnston.
Excellent. It is great to hear because when you can do business that makes life easier for people, makes interactions pleasant, boy, that's the kind of business you want to do.
Absolutely.
And we see that on the clinical side, right? So we don't see that as much with administrators necessarily. But on the clinical side, I think most people don't realize that the tensions that are on the average healthcare worker in the general system and the tensions that pull them away from being able to see the patient as priority number one and how are you today? What can I do for you? And it's not because they're bad people. It's just there are real legitimate tensions built into the system because of a variety of things I won't go into. And when you can cut that away, it is such a breath of fresh air for patients. And so we have patients that come in frequently, and wow is probably a good word. It's so refreshing to hear people say, they treated me like I was important, like I was a person. They didn't treat me like they had a bunch of other priorities, or I didn't fit into their square hole because I'm a round peg. And they said, okay, you got to go talk to someone else. So just that the beauty of what we do on the clinical side at Renovo is that our customers get to be treated as the real customer. the person who we need to focus on and give our attention to and make the best outcome for. And when you can have incentives that align for that, that's just amazing. And that's, if you're an employer, that's how you want your employees to come back from healthcare, right? I mean, nobody wants to necessarily interact with the healthcare environment, but when you have to have people looking at you and treating you like you're an important person and you're actually why I'm at work today. So that's really impactful. And I would encourage employers just to store that away and realize that you can't get that everywhere. And that when you can get that and tremendous cost savings, that is something worth looking into.
Yeah, you hit the nail on the head right there. Like you're the doctors in town. They want to meet your patients and take care of them. So we'll follow up with you after this, and you guys get to connect directly with Dr. Johnston as well as we talk about how we can kind of just add this to your health plan. You can start using it right away. So Dr. Johnston, thanks for your time. I really, really appreciate it.
Yeah, likewise. All right.
Take care.
Take care.
In the quiet storm of worry and fear, when the bills keep rising and the path isn't clear, there's a place where compassion meets honest light, where healing is simple and hope feels right. Renovo, Renovo, we renew what was broken. We help you let go. Affordable care with an open hand, restoring your strength so you'll rise again. Renovo, breathe easy now. Your health, your future starts here somehow.
No hidden costs, no endless wait, just skilled hands and hearts that alleviate.
From the first hello to the moment you're whole, we walk beside you, we lighten the load. Renovo, Renovo, we renew what was broken. We help you let go. Transparent prices, a promise we keep. Compassionate care that runs heartfelt and deep. Renovo, breathe easy now. Your healing journey begins right now. You are seen, you are heard. Every story matters, every single word. A new day is dawning, a fresh start awaits. At Renovo Health, we open the gates. Renovo, Renovo, restoring your body, refreshing your soul with kindness and clarity. We'll carry you through.